Welcome to this foundational module on aesthetic nursing patient safety. In the world of medical aesthetics, complications are a reality that every practitioner must be prepared to face. These range from minor, self-limited concerns that resolve with time to critical events requiring urgent clinical escalation. As an aesthetic nurse, your primary responsibility is the early recognition of complication patterns. You must be able to differentiate between expected post-procedure variations, like mild swelling, and clinically significant findings that indicate a true complication. Success in this field isn't defined by never having a complication, but by how effectively you identify and manage them. Management begins with structured categorization. By placing a patient's symptoms into a specific bucket, you can quickly assess the severity, determine the urgency of the intervention, and ensure your documentation is precise. Throughout this module, we will use a universal approach for every suspected issue. First, perform a physical assessment. Second, determine the category. Third, evaluate the severity. Fourth, notify your supervising provider per your specific facility protocol. And finally, document every detail objectively. Let's begin with asymmetry. This is, without question, one of the most frequently reported concerns in aesthetic practice. It's important to remember that human faces are naturally asymmetrical. However, post-procedure asymmetry can stem from several factors. It might be due to pre-existing facial structures that become more apparent once we start refining features. It could result from uneven product placement or technique variations during the injection. Crucially, differential swelling, where one side of the face reacts more intensely than the other, is a common culprit. Even variations in underlying muscle strength can cause neurotoxins to settle differently. It is vital to reassure patients that not all asymmetry represents a failure or a complication. In many cases, mild unevenness immediately following a procedure is simply edema or swelling, which typically resolves within a few days. How do we distinguish between what is normal and what is concerning? You should consider it likely normal if you see mild unevenness immediately after filler, or a slight variation in brow height in the early days following a neurotoxin treatment. If the asymmetry improves as the swelling subsides, you are likely on the right track. However, you must flag the asymmetry as concerning if it is progressively worsening over time, or if it leads to functional impairment, such as difficulty closing an eye or speaking. Most importantly, if asymmetry is associated with significant drooping, acute pain, or any neurologic changes, it moves from a minor concern to a clinical priority. Your nursing response involves a structured reassessment at an appropriate interval. Always compare the current presentation with the patient's baseline photographs if your policy allows. This provides an objective before and after that helps ground the patient's expectations. Educate the patient on the expected healing timeline and schedule a formal follow-up. If you determine the asymmetry is causing functional impairment or appears severe, do not wait. Notify your supervising provider immediately. Let's look at how we document this. A strong note would read, patient reports mild right-left lip asymmetry 24 hours post-filler. Swelling greater on right side. No blanching, discoloration, or pain. Findings consistent with expected post-procedure edema. Follow-up scheduled. Notice how this note rules out dangerous signs like blanching or pain while remaining objective. Moving on to ptosis. In aesthetics, ptosis typically refers to a drooping of the upper eyelid following a neurotoxin treatment. This happens due to the unintended diffusion of the toxin into the levator palpebrae muscle, which is responsible for lifting the eyelid. A key clinical pearl here is timing. Ptosis usually presents within several days after treatment. It does not happen immediately. If you see a droop the second the needle leaves the skin, you are likely looking at swelling or a different issue entirely. The clinical presentation is specific. The patient will describe a heaviness in the lid or a visible drooping. In pronounced cases, it can actually obstruct their vision. Note what is absent. There should be no pain and no changes to the skin color. While ptosis is rarely a medical emergency, it is a significant aesthetic complication that requires provider evaluation. As a nurse, you must assess the exact timing of the onset and confirm that there are no other visual disturbances beyond the lid droop itself. Notify your provider according to your protocol and provide calm reassurance to the patient. Because neurotoxins wear off, this condition is temporary. However, you must escalate urgently if the patient reports actual vision loss or other neurologic symptoms, as this could indicate a more serious underlying issue. A proper documentation entry would be: patient reports left upper eyelid heaviness on day 3 post-neurotoxin. Mild ptosis observed. No visual disturbance or pain. Provider notified for evaluation. Infection is a complication that can occur days after any injectable or device-based treatment. Because we are breaking the skin barrier, the risk is always present. Early recognition is absolutely critical to prevent the progression into abscess or systemic illness. Monitor for the classic signs of infection: increasing redness, warmth to the touch, and tenderness that goes beyond the soreness one expects after an injection. Look for localized swelling or any purulent drainage. You must also screen for systemic signs, such as fever, malaise, or red streaking extending from the site. Unlike normal healing, which gets better every day, infections typically worsen over time. If you suspect an infection, assess the severity and notify your supervising provider immediately. Follow your clinic's protocol for a formal evaluation and potential antibiotic treatment. This is also a vital time to reinforce patient education regarding hygiene and site care. If systemic symptoms develop, rapid escalation to a higher level of care is required. Your documentation should be clear. Day 4 post-filler. Increasing erythema and tenderness at injection site. Area warm to touch. No drainage observed. Provider notified per protocol. Delayed reactions are a unique challenge in aesthetics because they can appear weeks or even months after the initial treatment. This is most common with dermal fillers. These reactions might manifest as firm nodules or lumps at the injection site, persistent swelling that won't go away, or a generalized inflammatory response. Sometimes, these are hypersensitivity reactions triggered by a patient's systemic illness, like a bad bout of the flu causing their old filler to swell. The presentation is usually a gradual onset of firm lumps or redness. It is important to differentiate these from acute vascular events. Delayed reactions are not typically associated with the sudden, severe pain or immediate skin blanching seen in vascular compromise. When a patient calls months later, your first step is to obtain a detailed timeline of when the symptoms started and what might have triggered them. You must assess whether you are looking at an infection or an inflammatory response. Notify your provider and, most importantly, avoid attempting any correction, like trying to massage out a nodule, outside of a defined clinical protocol. The urgency of your escalation here will depend on how severe the reaction is and whether it is affecting the patient's systemic health. To wrap up these categories, let's review this severity matrix. As a nurse, you are the front line of triage. Your role is to recognize patterns and determine the level of urgency based on clinical findings, not the patient's level of anxiety. For example, mild asymmetry is usually not urgent and typically requires only a routine follow-up. Ptosis or eyelid drooping is also generally not emergent, but it should be evaluated by the provider. A local infection presents a moderate level of urgency and requires prompt notification of the provider so treatment can begin early. However, suspected vascular compromise is different. This is considered urgent and requires immediate escalation through the emergency pathway. You may also encounter delayed nodules, where urgency can vary depending on symptoms. In these cases, provider evaluation is required to determine the appropriate next step. Always rely on clinical judgment. Assess the findings, categorize the pattern, determine the urgency, notify the provider, and document clearly. Never delay escalation because of uncertainty. Early consultation is the hallmark of a safe practitioner. Now let's focus on the how of responding to a crisis. Escalation is a clinical responsibility. It is not an optional step. In aesthetic nursing, complications can evolve with frightening speed. A delayed response can lead to permanent tissue injury, systemic infection, or even vision loss. To manage this, we use a standard escalation sequence: stop, assess, notify, and activate. The first action in any suspected complication is to stop the procedure immediately. This means ceasing the injection or the energy delivery right then and there. Take your hands off the patient. Do not try to finish the area, or just do one more pass. Do not minimize what the patient is telling you. Stopping prevents the complication from progressing while you move to the next phase. Hesitation here is the most common cause of worsened outcomes. Next, assess. Your assessment must be rapid and objective. You are looking for pain, how severe is it, and what is the character? Skin color. Is it blanching, turning dusky, or showing a livido or mottled pattern? Check the capillary refill time. Is the swelling localized or spreading? Are there any visual complaints or changes in their airway? This step determines if the situation is stable, concerning, or a time-sensitive emergency. Third, notify. You must inform your supervising provider immediately if you suspect vascular compromise, visual symptoms, severe pain, progressive infection, or signs of an allergic reaction. Clear and structured communication is critical, which is why we use the SBAR format. Start with the situation by clearly stating what is happening. For example, you might say that the patient developed sudden blanching during a glabellar injection. Next, provide the background by briefly sharing any relevant history, such as noting that there were no prior complications. Then explain your assessment by describing what you are observing. For instance, capillary refill may be delayed to 4 seconds, and the patient may report blurred vision. Finally, activate the emergency pathway. This is for the most critical events: vision disturbances, vascular compromise, or anaphylaxis. This may involve administering emergency medications per your standing orders, calling EMS, or arranging an urgent transfer to an emergency department or an ophthalmologist. Time is tissue, especially in vascular events. Escalation doesn't just happen in the chair. It often happens after the patient has gone home. If a patient calls with reports of severe pain, color changes, or rapid swelling, your instructions must be firm. Tell them to return immediately or seek emergency care. Notify your provider and document the exact time of the call and the instructions you provided. Telephone triage is a legal record of your nursing judgment. We must also address the psychological barriers to escalation. It is natural to feel a fear of overreacting or a desire to not ruin the day's workflow. You might feel pressure to just reassure the patient that it's probably just a bruise. You must consciously override these impulses. In aesthetic medicine, it is always safer to escalate early and be wrong than to delay and be right when it's too late. We conclude with the most important rule of nursing. If it isn't documented, it didn't happen. In an escalation scenario, a clear timeline is your best defense. Note the exact time symptoms began, the objective findings of your assessment, the time you stopped the procedure, and the exact minute you notified the provider. By following this structured approach, categorizing the complication and following the stop, assess, notify, activate workflow, you ensure the highest standard of patient safety and clinical excellence. Always remember, escalation is not a sign of failure. It is a sign of a responsible, professional aesthetic nurse.